there. Welcome back to my office. This is Dr. Saira Saini again, and today I wanted to discuss with you a question that I was asked, and the question was, who is the best candidate to have cosmetic or plastic surgery? Is it a criteria based on age, a certain BMI, etc.? So that's a really good question. There is no specific age limit to have or not have cosmetic surgery. And cosmetic plastic surgeries can be done in the office with minimal anesthesia, with just some local anesthesia and some topical and maybe some topical anesthesia would be all that that person needs. Some people might need a little bit of an oral medication. So not every cosmetic / plastic surgery means general anesthesia. So if you are getting a larger procedure such as a abdominoplasty or a tummy tuck, then the amount of anesthesia needed would be greater. So to answer the basic question is there an age criteria? And there isn't one. It depends on your health. Usually, if you are a person who has any form of heart disease, high blood pressure, diabetes, your plastic surgeon would want you to see your primary care doctor and get a medical clearance. If you are a younger patient who is fairly healthy, without any comorbidities or any medical issues, then more than likely, if you're a female, a pregnancy test will suffice. Now, when it comes to the question of BMI, plastic surgeons who are board certified by the American Board of Plastic Surgery can offer their services at a hospital that has the full support for any medical or surgical emergencies. That's why it's important to know if your board certified plastic surgeon has credentials at a local hospital if they do procedures there, because that means they have been through the rigorous training to do cosmetic and plastic reconstructive cases, and your safety is their prime concern when they are tell you that they're going to offer you to do the service at a hospital, because over there you have a complete set of services in case of an emergency. Also, most board certified plastic surgeons that are working in a hospital will have a board certified anesthesiologist who is doing the anesthesia, along with board certified nurse anesthetists who are also trained in anesthesia. So that increases the safety of the procedure. So when it comes to the question about the BMI, the BMI criteria are dependent on the surgeon. So it's important to speak to your plastic surgeon, and they can tell you if your BMI criteria are such that your surgery has to be done at the hospital with a board certified anesthesiologist. If there is a question, I would say go towards the safety and pay the extra money to go have it done at a hospital with great monitoring, because your safety is always the most important thing. So if there is a question and your surgeon or your doctor feels that, this surgery is better done at the hospital, then go along with their advice and get it done there. Some people go find another provider who will do the surgery in the office, and to me, in my mind, that would be a little more risky for you. So the BMI criteria is surgeon dependent. The healthier you are on the day of your surgery, the better the chances that you will get the best results and your recovery will be faster. So if you are thinking about doing a procedure, go talk to your board certified plastic surgeon, and they may advise you to wait a little bit longer to go seek out a nutritionist or and find a healthy exercise regimen that will work for you. Or they may say, well, based on your BMI, I feel that this is safe, but I feel better if we do it at the hospital. Or they may say, nope, it's not a concern, that we can go ahead and proceed with your surgery. So when it comes to BMI, it is very surgeon dependent. So it's important to find a board certified plastic surgeon and discuss your concerns with them. The other question that comes up a lot is smoking. Why is smoking so bad? Well, smoking is so bad because it deters healing from any kind of incision that you had at surgery. Also, it hurts your lungs and your recovery from anesthesia a little bit worse. So when you have surgery like a tummy tuck and you have a history of smoking, the area that's at the end of the surgical dissection, the very edge of the incision, right above the mons pubis, the area below your belly button, is at the greatest risk for not healing or part of the skin becoming necrotic or dying and then requiring wound care. And if it's bad enough, you might even need a wound vac. So for that reason, it's very important to discuss your nicotine with your surgeon and make sure your surgeon can guide you. Most surgeons will say that they want a minimum of 6 weeks, and a preference would be 12 weeks for you not to be smoking, but a 6 week would be an absolute minimum for some procedures, and for others it would be 3 months. And the best guide for that is your surgeon. And so it's very important to frankly discuss this with your surgeon, explain to them the amount and type of nicotine and other products you're consuming, then they can guide you. It's always better to be on the safe side and wait a little bit longer so that you get the best result possible. I hope this helped. We have several other questions that are coming in. Thank you for sending them. And as they come in, we'll continue to respond to them. Thanks again. I hope you're having a wonderful day and make this a great one. Thank you.